All right. Are we ready? Thank you. Thank you. Hey, it's good to see everyone. Oh my gosh, my voice just went down. We got pollen out the ears around here. I don't know if y'all are, but in Houston, it's been like crazy. But anyway, hello and welcome. My name is Socorro Dunn, and I'm a mother of 4 now grown children. And I wish I would have known about this topic before I had children. I think I would have avoided a lot of doctor visits and a lot of worries. I became a partner with the Juice Plus company because I identified with their mission and because we've experienced better health than ever before. And a strong immune system, you can beat that now. Improving scarring from acne. I mean, I don't know if you can see some of them, but that has improved a whole lot. And also it has kept my eczema and psoriasis under control and even rerouted some of my ankle spider veins. If even held my palate. So it even changed to accept better foods than I used to eat. And of course, the beauty of food and good nutrition is that each of us will benefit differently depending on our body needs, what our body needs. We're here to help you with lifestyle change to improve your health with just one simple change. It does go a long way. So just don't think that you're doing one thing was not going to do anything, but it will, the consistency that you will do it. And because of the many benefits I've experienced, I love to educate people about their health because we can take control over our health. We have seen the need of it. Have you seen the last couple of years? We have. So thank you all for taking the time out of your evening to join us on our last session of our March into pregnancy. We started in March. So you get it? March into pregnancy. Excuse me. And it culminates tonight in the topic that we're going to be speaking of, because having a healthy pregnancy will have a healthy baby. And we designed the topic to be pregnancy into 3 sessions because it was such a large topic to speak it in just 1 hour. We decided to do it into 3. So part 1, we talked about how prepping your body is important for a vital, healthy child, baby. And it takes 2 to be pregnant. So we need the dad also be prepping their body. Second, part 2, we discussed what we can do to have a healthy pregnancy and therefore a healthy baby. And both were recorded. So ask the person that invited you for the recording. We'll be happy to share it. So now part 3, after you deliver that bundle of joy, then what? The conversation this evening will be about postpartum, post-delivery, and lactation or nursing. I bet during this talk, you will be thinking of some people who you wish could have heard this information. Please write it down. We can get them their recordings. Like I said, we recorded it and we're recording this one as well. We had a great Q&A session with Dr. Morris last time. Lots of great gold nuggets, and we will do the same tonight. I encourage you to take good notes. And if we didn't cover your question, please write it down in the chat and we'll take some of those at the end. Are you ready? So before I introduce Dr. Morris, I wanted to thank Juice Plus for inspiring healthy living around the world. Juice Plus is a great company with a heart and interested in getting the world healthier. It is also a simple solution to a problem we have of not eating enough vine-ripened fruits, vegetables, and berries, and also omegas. Those are 3, 5, 6, 7, and 9. It is the most researched and published nutritional whole food supplement in the world. Just ask Siri. Juice Plus is a way to bridge the gap of what you need to eat and we don't. We have a fast-paced lifestyle. Eating healthy is challenging, and not just that, but the quality of the nutrition in the food is not there anymore. And so we have to eat a lot more than we think to be nutritionally fit. I wanted to also share that we also have a program where our students ages 4 to 18, including undergrad college students, can have Juice Plus for free with a sponsoring adult order. We also have an aeroponic garden that can fit inside your home or outdoors to grow your own produce. And now, more crucial than ever, all our shortages and the price increase, you have seen, it will be very helpful and come in handy. So ask the person who invited you for more information about it. And if you're interested in learning more about our company and want to join us on this mission every Tuesday evening at 7:30 Central Time, if you go into www.startjpnow.com, and you'll get right into a Zoom call about that. So every Tuesday night. And we have events online and in person now that we're opening up. And one of them is going to be our conference. And I wanted to invite you because we're going to have a hybrid conference in person and also online. So on April 23rd, you're welcome to join us. And we're going to have a lot of great speakers, health professionals that you might be interested in. So again, ask the person who invited you. Now, I have the privilege of introducing our guest speaker, and who I have the honor to call friend, Dr. Melinda Morris. Dr. Morris is a retired obstetrician and gynecologist of 35 years and is board certified in clinical nutrition for the past 16 years. She's married with 4 grown children, 15 grandchildren, and a beautiful great-granddaughter. And as a physician, she continues to care for the health and welfare of others, even after retirement from delivering babies. Dr. Morris promotes organic whole food nutrition through Juice Plus, bringing the gap between what we eat, what we need to eat and we don't, and what our bodies need. She provides free nutritional and health lifestyle counseling. So let's get started. Okay, so we have gained the pounds and delivered the baby, and now we have a little sweetheart. Our hormones are going wild, lots of changes happening in just a few hours. So one of the questions that we think about, but we don't ask is, when will my body return to normal? And can it return to normal? Is there such a thing of normal?
Will it ever be back to normal? That's the question.
That's the question.
I'll preface this. These are just conversations that I had every day with patients in the office, and just advising them on lifestyle and nutrition and making recommendations because they come in for their 6-week postpartum visit. And, you have to say, hey, it took you 9 months to deliver that baby. It's going to take some time to get back to normal. And, the uterus, it takes 6 to 8 weeks to return to normal. So, you're in a high healing recovery mode after that baby. So all the good nutrition that you were maintaining through that pregnancy, so you'd have your healthy baby, you need to continue for at least 6 to 8 weeks postpartum, because your body is healing and your body needs nutrition to heal. So, and there's lots of changes going on. When you're pregnant, you're in a very high hormone state, high estrogen levels, high progesterone levels. And when you deliver that baby, those hormone levels drastically decline. And you immediately start noticing changes in your body because of that. And one of the hormones, the estrogen, is low after you deliver that baby. And it's actually designed that way, because if you're going to breastfeed your baby and you're producing oxytocin to make breast milk, it requires a low estrogen state. So that's why you have no libido, you've got vaginal dryness, it's painful to have intercourse, you don't even want your husband coming near you, and he's been waiting 9 months to come near you, so it creates some challenges. But if you know that it's because of the hormone changes, you can do things to kind of help the situation. But you need to make sure you're completely healed too. You may have had a cesarean section. That's going to be light activity for 2 weeks. It's going to take 6 to 8 weeks for that scar tissue to completely heal. You may have had a tear or an episiotomy. That's going to take at least 4 to 6 weeks to heal. And you need to give your body that time. You need lots of rest. I tell early moms, sleep when the baby sleeps, because you have this tendency that, you're thinking about the housework, all the things you need to be doing, the laundry, and you can't be up all the time and then up all night taking care of the baby, because your body's going to get exhausted. And then you won't have the health that you need to really care for yourself or the baby. So for the first couple of weeks, when the baby sleeps, you sleep, the house will still be there. In 4 to 6 weeks, the laundry, you got to make yourself and the baby the priority during this time to have your best recovery. And you need to maintain those prenatal vitamins, all the supplementation that you were on, because your body's in that healing mode, and you need a lot of protein for adequate healing, along with those vitamins and minerals. So it's even more important almost after you deliver that baby to maintain good nutrition.
Wow, that's actually one of my next questions. This is a two-part question: do my nutritional requirements change from when I was pregnant? And what are those nutritional requirements during postpartum and lactation?
Well, you want to make sure you're getting a good source of protein, and just not eating empty calories. Casserole of mac and cheese is going to be delicious. It's going to fill you up. It's going to give you calories, but is it going to give you the nutrition that your body needs? And you really need to continue to be thinking about that. Protein shakes would be an excellent source of nutrition during this time. You don't have a lot of time to cook or eat a meal. So a nice protein shake, mid-morning and afternoon is going to give you that protein source that you need and those extra minerals and vitamins. You want to maintain all the good vitamins that you were on during your pregnancy. Calcium, incredibly important. And if you're not a milk drinker, you need to be taking at least 1,000 to 1,200 milligrams of supplementation. Vitamin D, incredibly important. You need at least 2,000 to 4,000 units daily of vitamin D. You got to maintain all your B vitamins, your B6, your B9, and biotin is going to be very important. A very common complaint after ladies deliver their babies is that their hair falls out. And the reason that happens is because progesterone maintains hair growth. And your progesterone levels fall to zippo after you deliver that baby. So biotin supplementation will help prevent that postpartum hair loss. And you need at least 5,000 micrograms of biotin daily. Also, the most common complication after delivery, I'll ask this: do you all know what the most common complication is following delivery in the postpartum period? Postpartum depression is the most common postpartum complication. I mean, you think about hemorrhaging, bleeding, all the other, serious complications that can occur, but actually postpartum depression is your most common complication. 10% of women will experience postpartum depression. And if you had it with your, earlier pregnancies, then you're more than likely to have it with subsequent pregnancies. And nutrition is vitally important to help manage some of those depression symptoms. And we've done seminars earlier talking about the importance of omega-3 essential fatty acids. And they help, along with the B vitamins, those help produce your neurotransmitters in your brain, your feel-good hormones, your serotonin in your brain. So make sure you're staying on your omegas in that postpartum period. Plus omega is really good for your skin, hair, nails. So your brain, you can look good and feel good if you stay on your omegas. So, moms kind of forget about themselves. They're all focused on the baby, making sure the baby's getting adequate nutrition. But mom's going to be a better mom if she's getting her adequate nutrition as well.
Oh, wow. So you said that progesterone, it goes like bottoms out after the labor. Oh, wow.
Yeah.
That's the reason why you lose hair.
Yeah.
So well,
and yeah, and you start bleeding for the first time in 9 months, and that can last anywhere from 3 to 6 weeks. So it's like a never-ending cycle for a while, and it may stop and then start back up again. But your estrogen and progesterone levels are really low at this time.
Wow, very interesting. So, so what are the benefits of breastfeeding our babies versus bottle feeding?
Well, we recommend to all the moms, if they possibly can, to breastfeed. It's good for the mom, it's good for the baby, and it's Mother Nature's source. So nothing is better than mother's milk for the baby. And, they should start that process in the hospital if moms are interested. And it's not an easy process. I tell moms it's natural, but it's not easy. And it takes time. And for the first couple of weeks, you're just producing what they call colostrum, which is kind of a high protein serum. It's got vitamins in it. And importantly, it's got immunoglobulins in it. So it's the way the mother passes her immune protection onto her baby. So, this is Mother Nature's way of protecting that baby from illnesses, is it allows the mother to actually, pass on her immunity through that breast milk. So the colostrum is very important for babies the first couple of weeks. And any amount of time that you can breastfeed your baby is going to be beneficial. Ideally now they're recommending breastfeeding up to like 18 months after the baby's born. But even if you can breastfeed the first 3, 4, 6 months, that's going to be vitally important for your baby, your baby's digestion. Your baby's going to be healthier, going to have a healthier immune system. And it has health benefits for the mother as well. So the breast tissue in a woman doesn't fully develop until she is breastfed. So there's an increase.
What do you mean by that? Like they get.
Yeah, the mammary ducts don't fully develop until a woman breastfeeds. And so that's why there's an increased risk of breast cancer in women that don't breastfeed. So, so from a physiological standpoint, benefits for both mom and the baby, that's how Mother Nature designed it.
Isn't that amazing? Wow.
Yeah.
So what if you can't breastfeed, or there's some women that say, well, I can't breastfeed because I'm not producing enough and the baby is not getting enough nutrition.
Yeah. Well, and some mothers will do both. That's actually pretty common now, but you always want to breastfeed first before you bottle feed, before you supplement, because once they get a hold of that bottle, they'll fill up on that and then they won't want to breastfeed. And the only way you can produce more milk is to breastfeed more often. And initially you're breastfeeding every 2 to 3 hours. And you just feel like you're a human pacifier, because basically that's what you are. And you become, it's tender, it's painful, the nipples have to toughen up. I mean, it's a process, especially first time around. But it's so much better for you and your baby that you just hang in there, you stick with it. Families are supportive. Get old grandma to give you all the advice that she knows to give, and moms and aunts, because they've been through it. They know what it takes to be successful. But even if you're just breastfeeding a little bit and then supplementing, the baby is still getting that benefit that they wouldn't receive otherwise.
So if I address something too, I've had 4 babies and I nursed them all, but each baby is different. And even if you have breastfed the first time, the third time around, it was like a brand new baby. So be patient with yourself, that it's okay. Not the experience,
Definitely. Yeah. Be patient. It seems it's easier the second time around, just because you know what to expect. Where first time, I mean, this is like, wow, I didn't know it was going to be like this at all. But
my experience was the opposite. It was easier with the first one, but the third one, I was getting frustrated because it was like she wasn't latching on, and I was getting frustrated. So that was making it worse.
Yeah.
And so you would think I'm an experienced mom, but she finally did.
Yeah.
So,
and you got to watch the foods you eat when you're breastfeeding, because that goes into the breast milk. And if you're eating real spicy, oniony, garlicky foods, you're going to have a baby that may have a little gas problem or abdominal pain. So you have to be careful what you're eating, and you need extra nutrition if you're nursing. You shouldn't be trying to diet and nurse. I mean, those two don't go together. You need at least 1,200 to 1,500 calories extra per day if you're nursing, so that you have enough nutrition for your body to produce that milk. And you've got to drink a lot of liquids, at least 100 ounces of water, because you've got to drink enough water for yourself and enough water to make that breast milk. And if you're not drinking enough, you won't make enough milk. And if you're exhausted and tired, you won't make enough milk, because your body needs energy to produce that milk. So, if you're not getting enough rest, you're not eating well enough, you're not drinking enough fluids, you're not going to be as successful.
So you'll be always tired?
Yeah. But exhaustion will decrease your milk production.
And if you're not allergic to dairy, can the baby be allergic to dairy if you drink it? And will the baby show that or no?
Well, if you're drinking regular dairy milk, you're making human milk. So the baby's, getting the milk that it's designed to digest.
Okay.
And so many babies have allergies to, dairy, cow's milk. Some babies have to have soy-based formula if they're on formula, because it's just a different protein, and some babies tolerate it and some don't. But, whatever you're taking in, whatever source of dairy, you're still just producing human milk. Yeah. And that's what's best for the baby. But you've got to maintain your calories. And yeah, if you're not a milk drinker or you're lactose intolerant, the good news is we have so many alternatives now. I'm a big fan of oat milk, and it's full of calcium. You've got your coconut milk, your almond milk, your walnut milk. I mean, we have so many alternative choices now. And look on the label, and a lot of them have been supplemented with vitamin D and additional minerals and vitamins as well. So we've got some really good sources out there if you're lactose intolerant.
And they have even calcium in them, more than you would think.
Yeah.
Coconut milk.
Yeah, so read your label, but you're getting a good source of calcium and vitamin D with those other milk sources and a lot of those plant-based milk sources.
Wow, that's amazing. And also, if you're bottle feeding, then you'll be trying out too, because what if the baby doesn't take it and then another, that's even harder to do than if you're breastfeeding and the baby's gonna digest.
And the baby holds a human nipple different than a regular bottle nipple. So if they're used to breastfeeding, you're going to have to get one of those nipples that closely is more resembling the mother's nipple, because they won't know how to suck on it. They hold it different in their mouths. Yeah. So it's a total learning process for the baby too. So both mom and baby are learning how this all works.
Yes. And the baby's totally new, but they're going to go with what is easiest to get more food, right?
Yeah. So, I mean, their instinct is to just get food.
Yeah. Food and poop. So the last question I have is, what are some of the ways to maintain a healthy lifestyle, and how does Juice Plus help?
Well, first of all, don't go back to your old habits as soon as you have that baby. And, I hate to see that so many times. I mean, we have women, that were smokers. But as soon as they found out they were pregnant, they quit smoking. But then after they have their baby, they'll go back to smoking again. Or they finally were focusing on a healthy, nutritious diet while they were pregnant. And then as soon as they have their baby, they go back to chips and salsa or queso, and that's all they want to eat, or Doritos. So maintain that good nutrition and supplementation that you were giving your body while you were pregnant so that you'd have a healthy baby, but maintain that for yourself so that you'll be healthy. I mean, 70% of the illnesses in America are from poor nutrition and poor lifestyles. So, don't go back to the bad lifestyles. Use this pregnancy as a springboard to maintain health and wellness for the rest of your life. Now, if you had excessive weight gain during your pregnancy, then at some point you're going to want to try to get back to your pre-pregnancy weight. It's difficult to do when you're breastfeeding because you need those extra calories for the breast milk. But once you stop breastfeeding, then you can consider a weight loss program so you can get back to your pre-pregnancy weight, because you don't want to carry that excess weight forward to another pregnancy, because that's just going to increase your risk factors with the next pregnancy. So, but you can gradually, once you're all completely healed up and you go to your 6-week postpartum visit and they say everything is fine, then, you can start an exercise program and, start considering, maybe a weight loss program if that's necessary. But,
so don't go into a diet per se after you had the baby and after you stop nursing, or you're starting to stop nursing, then go ahead and start.
Yeah, if you're through nursing, then you can consider it, but you need those extra calories with breastfeeding. Now, well, I'll pose this question. Does breastfeeding prevent you from getting pregnant? Some ladies will consider using breastfeeding as birth control, because breastfeeding keeps your estrogen levels low. And a lot of times you won't have a cycle. Some ladies will not have a cycle at all while they're breastfeeding, or once they're about in 3 to 4 months into breastfeeding, they'll start having cycles again. And it takes 4 to 6 weeks of breastfeeding to produce mature milk. So, but don't count on breastfeeding as your only source of birth control, because I've had several patients get pregnant while they're breastfeeding.
Because they don't know when they're ovulating?
Because they don't know when they're ovulating, because they haven't had cycles and they have no idea when ovulation is going to occur, and they'll come back in pregnant. I've also had ladies come in pregnant before their 6-week postpartum visit. Okay. Wow. It's very easy to get pregnant again right after a delivery. So protect yourselves.
Wow, I have no idea.
You don't want a positive pregnancy test when you're coming in. You've just recovered from one pregnancy. And we used to call that Irish twins when you had 2 babies within 12 months. But it happens. Yes. And yeah, so you definitely want to protect yourself.
Now, what will happen if you do have them that consecutive, with not letting your uterus, get back to the way it was before you start another one? Does that cause anything, or?
Well, it is returned normal enough that, it's allowed for another pregnancy to implant. And I've had ladies breastfeeding during their 2nd pregnancy. They just need to maintain a lot of extra nutrition for that, because now they need the nutrition not only for themselves to breastfeed and for another baby. And, usually by about 4, 5, 6 months into the pregnancy, they'll wean the baby off and stop breastfeeding so that they can prepare for the next baby. But this is Mother Nature. This is the reality.
Well, so that's what God said to propagate.
Yeah, be fruitful and multiply. And yep.
He knows how
we're designed to be fruitful and multiply. Yes. So this is where I do a lot of counseling, so that ladies really understand.
Because then they will really get into much more depression too, right? The postpartum plus another pregnancy, or would that kind of help with the depression? Will it improve it or get it worse?
Well, I guess that depends on the circumstances. I would be kind of depressed.
Especially, well, one of the things you said in one of the first or second times that 50% of our pregnancies are unplanned.
That's right.
So, there's the shock of the idea just gets you.
Well, I've had poor moms crying, when they find out at their 6-week postpartum visit, they're pregnant again. But these things can just happen. This is life, and you just pick up and go on and, do what you got to do, face what you got to face.
So what can the dads do for the moms? How can they help them?
Let the moms rest when they need rest. Step up, help with the cooking, help with the laundry, help with the housework. So, she's not feeling guilty that she's not taking care of the home, and let her really focus on taking care of herself and the baby.
What kind of
Until,
food do you suggest for someone to get a lot of the nutrition, just a lot more fruits and vegetables, any
yeah.
particular fruit, or you know how you always hear, well, if you eat more of this fruit, you'll get more milk production. Is that true?
Well, you just want a good mix. 50% of your plate should be fruits and vegetables. And one of the mistakes we make in our American diet is we make it all about the meat. We have 50% of our plate is meat and a little scoop of vegetables. So it's actually supposed to be the majority fruits and vegetables. And if you do a wide variety, they're all going to be contributing the nutritional needs. And then you want clean, lean proteins. You want your lean meats. You want them baked. You don't want them coated and fried. So baked or broiled. And then your carbohydrates give you energy. So you do need your carbohydrates. But you can do that with your complex carbohydrates, your beans, your legumes, your vegetables. Provide the extra carbohydrates for energy because you need that as well.
So how many Juice Plus can a mom take while she's breastfeeding and I guess pregnant? Will they need to increase it just as much or not? Or
yeah, they would
pregnant
actually, because the nutritional needs are increasing, as that pregnancy progresses, and they need to maintain all that extra nutrition in postpartum. So, you need to double dose. If you have twins, you need to triple dose, so that you're getting enough adequate nutrition. And don't be afraid of nutrition. It's like, double dose. No, you're just eating food. It's nutrition. It's going to be okay. Don't
when
be
you're
afraid.
saying double dose, you mean
Don't be afraid of nutrition. Your body's going to absorb what it needs. You'll get rid of the extra you don't need. But don't be afraid of eating healthy food and nutrition and whole food supplementation, which is really just your natural food source.
got it.
Yeah.
I love this time. I know we've gone already over 30 minutes, but I wanted to see if anybody had any questions, and we can take a couple of them. Tiffany, do you have any, or Andrea, or?
I didn't have a question as much as I wanted to validate the doctor. I just recently had a stool sample, and as healthy as I like to think I am, she found that I need just, what did she say? 9 cups of mostly vegetables a day, because I didn't know you're supposed to have more vegetables than meat. And
Yeah.
of course, we're big paleo meat eaters over here, and just had dinner tonight, and that's what my plate looked like. It looked like more meat than vegetables. And I'm so hungry, right? Because she wants me to get on this. I don't know, Dr. Melinda, have you heard of the wall protocol?
Mm-mm.
It's the hardest diet I've ever done. I mean, not that I diet because I'm thin, but healthy. It's the hardest healthy diet I've ever done. And it's because my sample said that I had, too much of this and that, and it was imbalanced. And as healthy as I'd like to think I am, I'd be surprised at how people would be surprised at how they're not eating right, and how what you just said is what most people wouldn't have known. And I'm so glad that you said that, because it makes me look at my plate and go, this isn't right.
Yeah.
And I'm having to make.
We're supposed to have 7 to 14 doses of fruits and vegetables daily, and nobody's getting that. To get all the micronutrients that you need, to get the fiber that you need, to get the minerals that you need. And it's just not in our diets anymore. And if you go to the grocery store, you can't even buy enough of those fruits and vegetables and keep them in the refrigerator fresh long enough to consume them. And that's why supplementation is so important. Whole food nutrition supplementation. because it's providing what we're not getting in our own diets.
Yeah,
Mhm.
that's so true. And now my question was, you mentioned fiber. Does that also apply after on lactation? And just does it increase or does it stay the same as you mentioned before?
Well, fiber is important for your GI health. And it actually stabilizes blood sugar levels and lowers cholesterol. So, the fiber is going to be benefiting the mother. But you get the fiber from fruits and vegetables. That's your only source of fiber is fruits and vegetables. So, she's eating that nutrition that she needs to make good, healthy breast milk, but she's also getting the fiber that she needs. And, it's important for moms, if they were diabetic during their pregnancy, they want to maintain a diabetic diet afterwards, to help lower your risk of the adverse side effects of diabetes. It'll minimize your risk of getting diabetes later on in life. Our American diet is contributing to the increased rate of diabetes in America, along with obesity. So if you already have that risk factor, then you want to be very careful about your diet and try to lower those risks as much as possible.
Thank you. Yes,
Yeah,
Tiffany.
Tiffany?
I did just think of a question. Is there a diet or something that you can eat that could help produce and encourage breast milk? More production, or just at all, like for mothers who don't produce very much and they get discouraged? Is there something that you can eat, like brewer's yeast? Like they say, if you eat the lactation cookies with brewer's yeast, it's supposed to help your milk come in. Is this true?
Well, there are certain foods that are thought to help increase the breast milk. But what really increases the breast milk is frequent nursing. At least every 2 to 3 hours. Don't skip. Lots of fluids, because you've got to have enough water intake to produce that milk. And then if you're eating a rich, healthy diet in fruits and vegetables and protein, carbohydrates, you're going to produce that adequate milk, a good, healthy milk. Yeah. But there are some certain foods that are recommended to help increase, but it's not going to compensate for an overall good, healthy diet, rest, and frequent breastfeeding.
Thank
one
you.
last- Good question, Tiffany. One last question I just thought of is, how common is it for a mom to have breasts impacted from nursing, or what's the cause of that?
Do you mean like a blocked duct, or what do you mean by breast
When you get
impacted?
engorged, and then you just, I guess the baby's not getting all of it out.
Yeah, the engorgement is making more milk than the baby is taking in. And you have to realize that when newborns have the stomach the size of a grape, okay? I mean, we think they want to eat this huge amount of food every time. And, but they've got little teeny tiny stomachs. And some ladies just produce more milk than the baby can consume at one feeding. And those are the moms that need to go ahead and feed the baby and then pump and save and freeze their milk.
And then
So-
more because you're pumping.
Yeah, but engorgement will stop milk production. So you don't want to stay engorged. You want to go ahead and
Pump it out.
express all that milk, pump it out, and then be ready for the next feeding.
Okay.
Yeah.
All right.
Because when you want to stop breastfeeding, that's what you do. I mean, you basically stop and you get engorged, and you wrap ACE wraps around the breasts and keep them really tight. And then the milk reabsorbs. It takes about 3-4 days.
3-4 days for the breast milk to reabsorb?
Mm-hmm. Yeah.
Oh, wow.
Yeah. And if you can use cold cabbage leaves, that will actually dry up your milk. The cabbage will.
You mean on it or eating it?
You put cold cabbage leaves inside your broth.
What?
And it helps dry up the milk. but you just have to keep the breast bound tight, and not express that milk for 3 to 4 days for it to start drying up.
Oh, wow. Well, thank you, Dr. Morris, for your time, for your expertise, your wisdom, your joyful self. And thank you all of you for joining us and watching tonight. I hope this was very informative to you. It was for me, even as I had my own babies already grown, but at least I have that information in mind so I can help my own kids when that's their turn. So thank you, Dr. Morris. And thank you all
welcome.
for tuning in, and ask for the recording if you want it. We'll provide it for you. So see you next time. Thank you so much.
Okay. Bye-bye.